Patient records of the only person to die of Ebola in the U.S. suggest an emergency room staff that didn't connect the dots. A key red flag, the patient's travel history may not have been fully understood by all who initially treated Thomas Eric Duncan and then sent him home after the Liberian man's first visit to Texas Health Presbyterian Hospital in Dallas last month.
It's either incompetence or negligence, but either way, there is a problem.
In a statement, the hospital said they're reviewing Duncan's case and have changed intake procedures. But the patient's nephew gave more than 1,400 pages of hospital records exclusively to the Associated Press just days after his uncle's death. An infectious disease and emergency medicine specialist who reviewed the documents zeroed in on Duncan's travel.
The travel history was clearly noted on the nursing notes that he had traveled from Africa, but there's no mention of it in the physician's notes, and nor is travel history factored into the doctor's thinking on what may or may not be causing his illness.
Duncan did undergo a battery of tests in that first ER visit. Despite symptoms that might indicate Ebola and at one point his fever spiking to 103 degrees, he was sent home diagnosed with a sinus infection.
Since the patient had a lot of extensive blood testing as well as CAT scans, there may have not been much that the doctor thought needed to be done with that fever because there had been an adequate workup and nothing was really jumping out showing that something was going on.
Duncan returned to the ER 2 days later with more severe symptoms and was admitted.
The physicians in the emergency department on that second visit was on top of it from the very beginning.
The records show from then on, Duncan received extensive, comprehensive care, but it couldn't save his life. Cindy Sharp, Associated Press.